Today, we're going to talk about a powerful and precise form of cancer treatment, high-dose rate brachytherapy. Let's begin with the fundamentals. Part 1. What is brachytherapy? At its core, brachytherapy is a type of radiotherapy where we place sealed radioactive sources inside or directly next to a tumor. Think of it as a surgical strike against cancer. By delivering radiation directly to the target, we can maximize the dose to the cancer while significantly reducing exposure to the surrounding healthy organs. This makes it an excellent option for treating cancers in areas like the skin, eye, prostate, breast, cervix, and esophagus. Our focus today is specifically on high-dose rate, or HDR brachytherapy, which often uses a cobalt-60 source and is commonly used for gynecological cancers. So, how does an HDR treatment work? 1. First, a customized applicator is placed in or near the tumor. 2. A tiny radioactive source, attached to a guide wire, is then automatically moved into the tumor by a machine called an afterloader. 3. The treatment is meticulously planned. We control the dwell time and positions of the source inside the applicator to sculpt the perfect radiation dose. 4. A typical course of treatment involves 2 to 4 sessions, each lasting about 2 hours. Part 2. The technology behind the treatment. The heart of this system is the HDR Afterloader. This is a sealed, shielded machine that automatically and safely inserts the radioactive source. It allows for computer-controlled, precise treatment through multiple channels, all while keeping staff safe in a separate room. Key technical requirements for a modern system include at least 20 channels for complex treatments, a choice of radioactive sources, typically cobalt-60 or iridium-192, a control console that integrates securely with the treatment planning system, and a suite of critical safety features, emergency backup power, a manual crank for source retrieval, and comprehensive room monitoring with alarms, CCTV, and an intercom. We also use a range of specialized CT and MRI compatible applicators tailored for different cancers, from Fletcher suit applicators for the cervix to interstitial needles and intrauterine tubes. Part 3. Standards, safety, and quality assurance. This is a treatment involving significant energy, so rigorous standards are non-negotiable. Firstly, on sources, both cobalt-60 and iridium-192 are used. A key difference is their lifespan. Cobalt-60 has a longer half-life of about 5 years, meaning fewer source changes, while iridium-192, with a half-life of 74 days, must be changed more frequently. Because cobalt-60 has higher energy, it also requires thicker shielding in the treatment room. Secondly, on safety and protection, safety is our highest priority. The afterloader itself is a shielded safe, storing the source when not in use. The treatment room has multiple layers of protection, access control with interlocks, area radiation monitors with audible alarms, and warning lights. Staff must always wear dosimeters and be rigorously trained in emergency procedures, including how to manually retract the source. Finally, and most importantly, quality assurance. Our commitment to quality is continuous. Before any treatment, we verify the source's calibration and strength. Daily and weekly, we check door interlocks, emergency stops, and console displays. With every source change, we remeasure its strength and test the entire system. And for every single patient, we perform patient-specific checks. We use imaging, like a C-arm, CT, or ultrasound, to confirm the applicator is in the exact right position before treatment begins. We double-check that the plan created in the computer is the same one sent to the afterloader. For critical cases, we may even use in vivo dosimetry to measure the dose delivered in real time. In summary, HDR Brachytherapy represents a convergence of advanced technology, rigorous physics, and unwavering safety protocols. It allows us to deliver a highly concentrated, potent dose of radiation directly to the tumor, sparing healthy tissue and improving patient outcomes. I hope you enjoyed the video. Would appreciate it if you'd like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. I remain your host, Sunday Clement. Thanks for listening.